Hi, I'm Diana Hernandez, Communications Assistant for the City of Enid, and special guest with me is Fire Marshal Ken Helms with the Enid Fire Department. So Ken, thank you for taking time to be here.
Thanks for having me. Appreciate it.
Awesome. We are going to jump into a lot of information that you have to share with us. So the first question is, how has COVID-19 affected the fire department?
It's been an interesting 2 or 3 weeks, just adapting to all the constant changes in protective measures and protocols for our guys, and communicating those changes to 3 shifts and 80 members on the department, trying to make sure everyone understands what they need to do to protect themselves and protect the public. So it's been interesting.
Now, have you received a high spike of medical calls?
We have not. We're seeing about the same rate of medical responses that we've had in the past. If there is a spike at all, it's pretty much not measurable at this point. We do respond to a lot of medical emergencies in Enid. We have a significant number of seniors in our community that we respond to very frequently. Our protocol is that we have a tiered response with Life EMS. They're the paramedics, they transport patients, but we respond to almost all medicals. To assist them. We have a quicker response time. We can get there and we can do some patient assessment, make them comfortable, give them oxygen, do things like that to kind of get them ready. And then when Life EMS arrives, we will assist them if they need it in loading the patient and that sort of thing. So we typically respond to 4,000 plus medical emergencies per year. So that hasn't really changed. We're still seeing about the same numbers. We're trying to be a little bit more selective about our participation with Life EMS. If a patient doesn't really need assistance from us, we may hold back a little bit and let Life EMS have the direct patient contact sometimes, but we're still going to arrive. We're still going to do what we can to help people. So.
Now, firefighters that go to medical calls, do they have N95 masks, gowns, PPE that can help them?
We have a supply of that stuff now, and we have a protocol for how that's supposed to be used. One thing that people might see a little bit differently now is that, we travel in groups of 3. A crew has an officer, a driver, and a firefighter. They're trained and accustomed to working as a team. So they typically, one of them grabs the medical bag, one of them grabs other stuff they might need, and they go into the house together as 3. We're trying to be more selective about that, and what they may see differently now is that one responder comes to the door, one responder deals with them and their needs, unless he needs those other guys. If those other guys are not needed, rather than just all storm in and stand around and potentially expose themselves to something they shouldn't, the other 2 may hang outside the door, just wait for instructions or bring equipment or do things like that. So we're being a little bit more careful about how we approach patients now.
So a patient, if they were to call and they would see firefighter truck pull up, they would expect a knock on the door and then some questions if they're...
Sure. That first responder that comes to the door is probably going to ask a few questions before he approaches you. He's going to stand at the door and say, okay, what's going on today? What's your problem? How can we help you? I know the ambulance is on the way, but is there something I can do for you in the meantime? And he's going to determine, do you have flu-like symptoms? Is this a high-risk patient? And if they are a high-risk patient for COVID-19, then he's going to take some extra protective measures for himself. And probably the first thing he does when he approaches that patient is put a surgical mask on them like this one.
Surgical mask. And he'll put that on the patient?
The surgical masks are intended for the patient, yes. So if we have a patient that we feel is a potential COVID-19 patient, we want to put that mask on them to protect ourselves and kind of isolate, if they cough or sneeze or something like that. And that's probably the most important thing we can do at that point. But our responder would be wearing the infamous N95 mask like this one that is becoming hard to find, a little bit short supply. We do still have some. We're working to get more. If we have to at some point, we can switch and start using self-contained breathing apparatus. But that creates other disinfection protocols and things that we have to do. So a disposable mask like an N95 is best for us. But if we run out, we have a backup plan.
You do. Great. Now, how are shifts being I guess, mitigated now with social distancing in place?
Well, our stations are large enough that we can keep our distance from one another pretty well. Station 1 has more personnel, so it's a little bit trickier. We typically have 12 to 15 people on duty at Fire Station 1. They have shared dining areas, shared kitchens, shared living areas, and things like that. So we just have to be a little bit more careful, and we're disinfecting things constantly. So we're just doing the best we can with what we have to work with. But these guys live together and work together for 24 hours at a time. So.
Right. Now, have you locked down the fire station to the public?
Yeah, we're not. The lockdown sounds like very restrictive, but
Yes.
but yes, the stations are not open to the public right now. Normally, we like to make things very open. We invite people to come and bring their families or school groups and things like that for station tours, and we like to show off our big red trucks and things. But we've had to put that on hold. We do still provide some services if people need assistance with car seats. We have some technicians that help with that frequently. You might call first to make sure someone's available that has that training that can help you with it, but they can come out and assist you with those things. The front door is locked, but there's a doorbell and there's a phone number you can call to get someone to come and assist you. There's someone always going to be there. So burn permits for folks that are cleaning up their yards and maybe need to do some open burning. We're still issuing burn permits, but we're doing those the same way. We come to the door and help you instead of you coming into the station. So.
Okay, great. Now, how meticulous is the cleaning and disinfecting after a firefighter has made contact or someone has made contact with the patient?
It's going to depend on the symptoms that are presenting and whether we think that is a high-risk patient or not. But anything that we expose the patient to, all of our equipment, our oxygen bags, medical bags, and things like that that we carry into the home, they will need to be disinfected before they go back on the truck. So they're doing some disinfection stuff on the scene before they load their truck up again. They're removing their personal protective equipment and putting it into a biohazard bag and that sort of thing. And we've got some pretty strenuous infection or control programs at the fire stations themselves to take care of things around the station and the trucks, things that we use. So. One thing I wanted to mention is what you see here. This is normally, this is an SCBA, a self-contained breathing apparatus. This is what we use to go in and fight structure fires or to wear the mask in any kind of a non-breathable atmosphere.
Okay, this is what you would...
This is what they would normally wear,
okay.
What you see the firefighters wearing on their back when they go in to fight a house fire. We have adapted this one with a spray gun and a disinfectant solution that we use around the station. The Tulsa Fire Department actually kind of came up with this idea and started distributing information about it. They're actually mixing up some of this disinfectant solution and helping distribute it around the state as well. It's like a chlorine bleach, but it's not exactly. I think it's called a hypochlorous acid solution that is very effective at killing virus, but it's not toxic. It doesn't corrode our equipment. It doesn't fade fabrics and things like that. It's very safe to use, but it's very effective at killing virus. So we have instructions to use this. Actually, the directive went out yesterday for us to disinfect the entire station, morning and evening, the inside cabs of all of their trucks, apparatus, the equipment that they use and that sort of thing. And then we would use this again after an incident where potentially we have an exposure to something. So we're pretty grateful to Tulsa Fire Department for helping with this, and they've got quite a bit of attention for it, but we're glad that they did. And the spray gun, this is really just a convenience factor for us. We could do this with an air compressor and a hose, but we've got a tank with 4,500 pounds of pressure in it. We can walk around, we can spray inside the trucks and then put it away when we're done. So kind of getting an extra purpose out of that. But it's also convenient that we have a new Harbor Freight in town to go buy the spray guns, so that worked out well for us.
Right.
But the advantage of the spray gun and this high pressure is that we're able to provide just a really fine mist that covers surfaces very completely. If you were using a pump sprayer, you'd get larger droplets, and there's space between the droplets, and you have to put on enough that they all run together. We can do this with a minimal product and not have to wet surfaces down quite so much. and conserve product as well, but still get the same kind of disinfectant properties out of it. So we're pretty excited about having this system in place.
That's great. Now, you are in communication and collaborating with other fire departments then, like Tulsa.
We stay in touch quite a bit through, a lot of our information comes through the International Association of Firefighters, which is the firefighters union nationwide, pretty much. They have been in constant contact with the CDC and health departments around the country, and they take protocols that are written for healthcare providers in general, and they boil it down really well to what's appropriate and effective and relevant for firefighters and what we do. So a lot of our guidance is coming through the IAFF rather than directly from CDC, but we kind of check back and forth. We get new bulletins from CDC and World Health Organization and the Oklahoma State Health Department practically every day with some new guidance.
So the Department of Public Health is one of those two?
Yes, Oklahoma State Department of...
That's right, okay. Now, is it really fluid information? Do you feel like you change protocols quite frequently?
That's all I've done for 2 weeks is write protocol, yes. So we're constantly updating and revising things. We had to put out a directive yesterday about using this equipment and how to use it properly, how often to use it, where to use it, that sort of thing. The protocol about using a single responder instead of teams of 3, we had to write directives about that. And so communicating that across 80 members and 3 shifts is challenging, but we feel like we're doing pretty well with it so far. And the guys are doing a great job at trying to stay on top of things and follow new procedures. There are 2 things that firefighters hate typically. One thing is change, and the other thing is the way things are. So things that are new, things that are changing create friction and challenge, but they're being very cooperative and helpful and doing the best they can. So we appreciate their hard work.
Now, a couple of weeks ago, you had a crew of 3 that went out to a call that there were suspicions of that this patient had COVID-19, and they were placed on self-isolation. Can you tell me a little bit about that?
Yeah, that was before a lot of the protocols had come out from CDC and the other groups that we're dealing with. And so we had a crew that responded to a patient that was taken to the hospital. And after they got him to the hospital, it was determined that he had some flu-like symptoms and they were going to test him for COVID-19. In the absence of any particular protocol about that, when they contacted the chief, he just put them all on administrative leave and said stay home and self-isolate until we learn more. And so we did keep them at home until we got the results of the patient's test back. He tested negative and they were all able to return to work and none of them were sick. I think it took about 9 days to get the results of that test. So they were home pretty antsy. They were ready to get back to work when they got the all clear. We have since learned that unless they have, the CDC defines high risk and low risk exposures. They actually have a medium as well, but we've kind of boiled it down for our purposes to high and low. A high risk exposure is if we have a known COVID-19 patient or one that tests positive for COVID-19 and we haven't put a mask on them, we haven't put proper protective measures together for ourselves, we're not wearing masks or gloves and things like that, and we've dealt with that patient directly, then that's considered a high-risk exposure and we would need to put those members in isolation again or quarantine while we wait to see if they develop symptoms and that sort of thing. If we do everything the way we're supposed to, and we put a mask on the patient and we put a mask on our guys and they're wearing gloves and they're doing all their protective measures, then they should never have anything greater than what's called a low-risk exposure. And the recommendation for low-risk exposure for first responders is you continue to work and you monitor yourself. You take your temperature twice a day and you check yourself for a list of symptoms twice a day and you keep a record of that. And if you start to exhibit symptoms, then's when we send them home and we wait to see if they develop further symptoms or kind of see where things go. But if they've never experienced more than that low risk exposure, they can continue to work and just monitor. And actually, they changed that about a week later. So now all of us, whether we have that low risk exposure or not, whether we've dealt with a potential COVID-19 patient or not, the entire department is we've directed them to come in through a single entrance at each station. There's a check station there where they check their temperature and they record all of those different symptoms that they, have to check. No, I don't have any of these symptoms. And if they develop any of the symptoms on the list related to COVID-19, then they don't continue into the station and contaminate the station and stuff like that. They go back home, or they stay home if they've developed symptoms the night before. So, and then we do that again at 5 o'clock in the evening for everyone on the department. So, it's the protocol is basically self-monitoring, but we've made it a kind of a requirement that they do it at certain times every day and keep a record of those checks. So far we have a pretty healthy workforce.
Okay.
We've had a few guys that have been home with flu symptoms, but they have tested negative. But in the abundance of caution, some of them, their physicians have said, sometimes the tests are not accurate. There's only about, I think, a 60% accuracy rate for some of the tests. So out of an abundance of caution, even after they've stopped exhibiting symptoms and they've tested negative, under doctor's orders, maybe they're staying home an extra couple of shifts. So I think, I don't think anyone is sick now. We've got some that are on that recovery end of things that they're anxious to come back to work, but they're just waiting for the all clear right now. So.
Now, when it comes to PPE, do you guys monitor the usage of it?
The State Health Department has asked us and all agencies that are using PPE, especially if we expect them to help provide replenishment of those, that we have to submit a report daily about how many gloves, masks, gowns, things like that we're using, so that they can prioritize who gets those when they get a supply of them.
So you do have a backup plan if by chance you run low?
Yeah, I don't expect us to run out of gloves. We've had a pretty good supply of gloves for a long time, but we go through a lot of gloves. The N95 masks, we could run out of those. If we need to, we can start using SCBA. They're heavy, they're cumbersome, they're awkward, they make it difficult to deal with a patient, but they provide a good level of protection for our guys. If we need to revert to
using the breathing
apparatus, we can do that. It has, then when we're done, we have a lot more disinfection and cleaning and stuff to do before we put it back in service. So the disposables are the preferred choice, but if we run out of those, we do have a backup.
Great. Now, is there anything that the community can do to help Enid Fire Department?
The biggest thing is just understand that you're going to see things a little bit differently. One thing we did that wasn't really related to COVID-19 at all, but several months ago we started responding to medical calls with our grass rigs instead of our big fire trucks, and we talked about that previously. So you're not going to see the great big fire truck pull up in front of your house. You're probably going to see a smaller grass rig. It's still going to have a crew of 3 people on it, but only one of those guys is probably going to come in the house to deal with you directly. And unless there's a prevalent need. If it's a cardiac arrest or we've got someone that's badly injured and bleeding and you need more hands on patient, yeah, we're there, we can do that. But if we can treat that patient and make them comfortable and provide everything they need until the ambulance arrives with one responder, that's going to be our choice. And you're going to see us wearing masks and gloves and things that we weren't quite so careful about doing in the past.
And it helps with time and also other resources like gas and mileage.
Yeah. The other thing is when you call 911 and talk to the dispatcher, they're going to ask you more questions than they have in the past. They're going to be asking, do you have any flu-like symptoms? Have you had a fever? Do you have a cough? Have you had any chills and things like that? So they can kind of help pre-identify as we're en route what we might encounter when we get there. And so that helps us know how carefully we need to protect ourselves when we arrive on the scene. So be patient with the dispatcher. She's going to ask you more questions than you want to answer, but answer those as carefully as you can. And don't worry that if you tell them, yes, I have flu-like symptoms, we're still coming. We're not going to detour away from a potential COVID-19 case. We're going to do everything we can for you, but it helps us prepare better and protect you better and protect ourselves better, so we can continue to protect our workforce and continue doing this as the number of cases rise in the community. So,
all right. Is there any last comments that you want to make?
I just encourage everyone to continue to follow the guidance that's been put out there about the social distancing. It's hard, it's inconvenient. It seems in some respects un-American to be this separated, and I understand. I'm as frustrated as anyone is about it, but do the best you can to protect yourself and protect your family and the rest of the community. So.
Awesome. Thank you, Ken, for joining us. And thank you, viewers, for watching. Join us tomorrow for another COVID-19 Live, where we will be live via Zoom with ETS Counseling, Rebecca Croker.